So that is one of the most challenging parts of my job, is managing these side effects. So, I always, paclitaxel, for example, one of the most commonly used drugs for ovarian cancer. I always tell my patients that the #1 side effect that ovarian cancer patients complain about is hair loss. And paclitaxel causes alopecia, it causes hair loss. Second to that, paclitaxel in combination with carboplatin causes fatigue. It causes, the paclitaxel especially causes neuropathy. Neuropathy sounds like a benign side effect, but the reality is these women can't feel their fingertips or their toes. If they're elderly, they slip and fall in the supermarket. They can't button their shirts. They can't play the piano. So they can't turn a page of a book. So it really, neuropathy sounds benign, but we don't have a good medication for it, and it can be semi-permanent, and there's really there's really nothing that we have that's good to offer to manage it. So, and then nausea and vomiting can also be a side effect of the chemotherapy drugs, of both carboplatin, paclitaxel, and carboplatin and gemcitabine. Gemcitabine tends to cause more hematologic toxicities, as well as some pretty noteworthy fatigue. Which again, just like neuropathy, fatigue, we do not have a good treatment for. And it's very hard to have a platinum sensitive or platinum resistant patient who feels intense fatigue. Bevacizumab, on the other hand, I think it's really worth pointing out that bevacizumab is a very well tolerated drug. Most of the toxicities related to it are manageable. We have medications to manage hypertension. Most patients don't come off drug for hypertension. We're able to control it with medications. Some patients get proteinuria, but again, not usually a reason to delay treatment or even stop treatment altogether. So overall, I feel as though bevacizumab is a pretty well tolerated drug that patients can stay on for long term. You do have to talk to a patient about the risk of bowel perforation, the risk of fistula, but those are very rare side effects, rare toxicities. You have to caution a patient about it, but really it's not something that you deal with very often.